Alright, so if you don't mind, before you go in to see the doctor, there are a couple of pages of paperwork we need to go over. Alright, perfect. Figure it might be a tad quicker if you and I just answer the questions quickly, and then you can go about your appointment with your physician. Alright, perfect. So, to the best of your knowledge, just answer these various questions. I have a present medical history, a past medical history, I have some family details, diets, and any other questions, comments, concerns that you may have for your particular doctor. Alright, so let's go ahead and jump right in then. So we're going to, for the present, currently, we're going to check the questions which the answer is yes, and of course we will check the answers that they are no if you do not presently have this. Perfect. So, has a doctor ever told you that your blood pressure was too high? Okay. Do you ever have pain in your chest or heart? Are you often bothered by a thumping heart? Does your heart often race? Do you ever notice extra heartbeats or skipped beats? Are your ankles often badly swollen? Do cold hands or feet trouble you even in hot weather? Has a doctor ever said that you have or have had heart trouble, heart attack, things of that nature? Do you suffer from frequent cramps in your legs or extremities? Do you often have difficulty breathing? Do you get out of breath long before anyone else? Alright. Do you sometimes get out of breath when you're sitting still or sleeping? Has a doctor ever told you that your cholesterol level was too high? Has a doctor ever told you that you have an abdominal aortic aneurysm? Has a doctor ever told you you have a critical aortic stenosis? Any other comments, questions you want for that particular area? Alright. See, not too bad. Alright, so do you now or have you recently experienced any of these? Okay. Chronic or recurrent morning cough, episode of coughing up blood, increased anxiety or depression, problems with recurrent fatigue, trouble sleeping, or increased irritability, migraine or recurrent headaches, swollen or painful knees or ankles, swollen, stiff or painful joints, pain in your legs after walking only short distances, foot problems of any kind, back problems of any kind. And have you seen any sort of massage therapist, chiropractor, anything of that nature? Any stomach or intestinal problems? Yes, this could include recurrent heartburn, ulcers, constipation or diarrhea. Significant vision or hearing problems. Do you know the last time that you saw eye care? Alright, and have you ever had a hearing test? Okay. Notice any recent changes to a wart or mole? Glaucoma or increased eye pressure? Let's see, exposure to loud noises for long periods of time. Okay. An infection such as pneumonia accompanied by a fever. Significant unexplained weight loss. A fever which can cause dehydration or rapid heartbeat. Good. Doing quite well. Alright, now list hospitalizations, including dates and the reasons for those hospitalizations within like the last 2 to 3 years. Have you been in the hospital? When was this? Oh, right, I see. And the reason, alright, but that's no problems with that to date. Good. Now, any sort of drug allergies that we should make note of, any sort of medications that you're allergic to? Okay. Now, your past medical history, we're going to check off the ones that you've had a past issue with. Alright, and of course we will mark no if that's not the case. Good. So a heart attack, and if so, how many years ago? Oh, let's see, a heart murmur. Any sort of disease of the arteries, varicose veins, arthritis of the legs or the arms, diabetes or at least abnormal blood sugar tests, dizziness or fainting spells, epilepsy or seizures, a stroke, okay, scarlet fever, any sort of nervous or emotional problems, anemia, thyroid problems, pneumonia, bronchitis, asthma, any sort of abnormal chest x-ray, other lung diseases or problems. Alright. Injuries to the back, arms, legs or joints. Right. Was that the result of a car accident? Alright. Any sort of broken bones? Jaundice or gallbladder problems? Now, any other comments that you would like me to add to your chart here regarding your past medical history or any of the previous things I just listed? Alright, so we're going to move on to your family history. Again, to the best of your ability, we do understand that you may not have every single ailment that is in your family tree. Alright, so your family history, let me see, your father's name. And is he currently alive? How old is he? Now, would you say your father's general health is excellent, good, fair or poor? Good. And your mother, her name? And is she with us? Good. And her current age? Good. And again, her general health, is it excellent, good, fair or poor? Is there a reason for that? Now, do you have any sort of siblings? Alright, yes, we would be asking for blood related siblings. Full siblings, half siblings. Alright. Any sort of health problems there? Alright. So family diseases. Again, we're just going to check off the ones that would apply to you and your family. So have you or your blood relatives had any of the following? Now this is going to include grandparents, aunts, uncles, but it can exclude cousins or relatives, of course, by marriage. So, heart attacks under 50, strokes under 50, high blood pressure, elevated cholesterol, diabetes, asthma or hay fever, congenital heart disease. Do you know if it was existing at birth but not particularly hereditary? Depends. Any sort of heart operations, glaucoma, leukemia or cancer under 60. Okay, and again, any sort of comments you'd like me to leave for that family diseases section? Alright, good. Good. Now, let me see here. Other risk factors here. Have you ever smoked cigarettes, cigars, or a pipe? Alright. Okay. Now, if you did at any point smoke cigarettes, how many per day? And when did you start, the age? Okay, and if you did smoke any cigars, how many per day and the age you started? And the same thing with the pipe. Stopped. Now your diet. What do you consider a good weight for yourself? Do you know offhand the most you've ever weighed? How old were you then? And your current weight we got coming in, so that, okay, good. Do you know what your weight was a year ago? Has it been pretty much the same? That's what I thought. Alright. Now, how many number of meals do you usually have per day? Do you have the breakfast, lunch and dinner, or snacks, or... Alright. Good. Perfect. Right. Number of times per week that you usually eat any of the following, okay? So, beef, pork, fish, desserts, fried foods. Good. Now, number of servings, cups, glasses or containers per week that you usually consume these particular. Milk, whole milk, 2% of low-fat milk, buttermilk, a 1% milk. Alright, coffee. Okay. Let me see here. Actually, breezing quickly through these. Tea, iced or not, regular or diet sodas, and what about glasses of water? Do you drink alcoholic beverages, and if so, how many per week, how often? Alright, so any beer, wine, hard liquor? Alright, now at any time in the past were you a heavy drinker, consumption of 6 ounces of hard liquor per day or more? Okay. Do you usually use oil or margarine in the place of cholesterol, shortening or butter? Alright, do you usually abstain from extra sugar usage? Do you usually add salt to the table? Now, do you eat differently on the weekends compared to the weekdays? Some people it's quite a difference. Right. Alright, so let me just see here. That might be all of it for us. Present, history, past history, family history, siblings, familiar diseases, other risk factors, smoking, diet, alcohol consumption. Right. Now, did you have any sort of questions, comments, concerns? Perfect. Well, you are all set then. I will add all of these paperwork details to your chart, and the doctor should be ready for you in just a few short minutes, so you can go ahead and take a seat. Of course. No, I don't mind at all. Good.
As always, thank you to my lovely patrons. This month I would like to thank Lloyd, Junker, Dave, Sydney, Maximus, Ivory, John, Mark, Matthew, Elliot, Ray, Alex, Justin, Douglas, Dracula, Monique, Sean, Colin, Light Fury, Garage, Sean M, Jay, Matt, Jordan, Dave, Nick, Fender, Andrew, Chris, Ian, Malachi, Amy, and Boris. Thank you so much, lovelies, and rest well.